Hello. Before I have the patient in the chair, I have to double check that he is here for the right reason. So I go to Axiom and I check the past medical history and the referral form, and I see that the patient is here for the extraction of tooth number 30. Next step is I check the patient's vital signs to make sure that we can treat him here in NYUCD facility and we don't have to refer him to the medical hospital. So his blood pressure is 120 over 80, his pulse is 60, and his respiratory rate is 10, and his temperature is 98.6, which are all within normal limits, which puts our patient in ASA category 1, which means we can treat him right here, as we can do both categories 1 and 2. Hello, I am student Dr. Gurlev. So do you know what you're here for today? No. Yes. We are going to be doing an extraction on your tooth number 30, which is a right lower molar, located right here. Okay, it's right here. Now it's very unfortunate that we have to take it out, but the alternative of keeping it in is going to be detrimental to your health because the tooth is in such bad condition that it will develop possibly an abscess or something even more severe, might lead to a periodontal disease, and we don't want that happening. So the best case scenario is to take it out, and maybe at a later point we can discuss things like a possible implant. We would have to evaluate you for that, but for today all we are doing is extracting it because that's the best course of action. Do you have any concerns? No. Have you ever had an extraction before? No. Okay. Well, it's not as bad as it seems. You will be anesthetized. You will feel very little discomfort, mostly pressure, really no pain. On a scale of 1 to 10, how would you describe your anxiety level? 5. I can work with 5. Okay, so as far as the possible side effects of the procedure, you are basically the most major risk at this point is some pain, which is what we call a dry socket, when it doesn't heal properly. But don't you worry about that. We will prescribe you plenty of medication if that's going to be the case. Though right now I do not anticipate any complications, so over-the-counter medicine like ibuprofen is going to be just fine. Now I have this consent form for you, which I would like you to sign. It mentions all the possible side effects. And please, if you see anything concerning you, just ask me right now. Yeah, I'll sign it. You'll sign it. Awesome. There's a pencil. Oh,
Okay, so today we're going to be doing a non-surgical extraction on number 30, and some of the armamentarium that we will need is a rubber bite block, a piece of 4x4 gauze, which we use as a throat screen and also at the end for the patient to bite on, a periosteal instrument, and this is how, when you go in and you start to loosen the ligaments, a small straight elevator, a large straight elevator, mandibular forceps, and then a curette after you get all the tooth out to clean up the area. And then you'll go in with saline to clean out the socket. Throughout, you can use suction to make sure that a small suction to keep away blood from the area, and then a large suction when you go in with the saline. And then throughout the procedure, I'll be using a cheek retractor. Okay, so for proper PPE, we have a mask, gloves, eyewear, and a yellow gown, and then for the patient, we have goggles and a bib. So for this procedure, we're working on number 30, which is on the lower right, and the anatomy that we have to be concerned with is the actual mandible itself, because that could fracture with under too much pressure. Also, the alveolar nerve is coming through this area, and we check that beforehand with x-rays to see how close we are. It's not too much of a concern with this tooth, more so with the wisdom teeth that are farther back and closer to the nerve. And then also another thing that we should be careful with is when we're holding our elevators that we have a finger rest so that we don't slip and injure the patient in any way. And then also we just want to make sure that the patient is in this seated up position, and then I'm on the right side because I'm right-handed. So now for the extraction of number 30, you start with a bite block and you place it on this side, and it's to keep the TMJ stable on this side and to keep the patient open and prevent any injury. And then you'll place a piece of 4x4 gauze in as a throat screen in this area to protect from any debris that could possibly come out during the procedure. Next, I would use this as a cheek retractor and place it in and pull its cheek away so that I can see a little bit better in that area. The first instrument I use is this periosteal elevator, and this is how you basically move the ligaments, and you put it in the mesial and distal area, and you just kind of twist around until you can get it all the way around, and you can feel that you have an area to work with in the ligament area. Next is the small area, and then you also go in from the mesial and distal side, and the idea is that you're spinning it and you want to be able to make a full rotation, and that's how you'll know that it's becoming more loose. The next is the larger straight elevator, and you do the same movement, and you go all the way around in the mesial and distal area, and you make sure that the serrated edges towards the tooth. Throughout the procedure, you can have your assistant using the suction just to keep any blood out of the way and any spit, just to keep that on that side. Next is the mandibular forceps. In that, you go into the buccal and lingual area, and you want to place it as apical as possible. So once you get that down, you'll go in a figure 8 motion and slowly pull up onto the tooth. And once you get the tooth out, you want to check to see that you have all the root tips and everything. The next step is to use the curette, and you go back into the socket, and you basically, that's just so you clean out the area of the socket. After that, you'll have your assistant holding the large suction. So then you go into the socket and clean it out with saline, and just make sure that whole area is cleaned out. And then last, you'll go back in with a piece of gauze, you'll fold it, and then you'll put it onto the socket and have the patient bite down for 20 minutes. And I'll check and ask and see, are you okay? How are you feeling? And then we'll come back in 20 minutes and check on them.
So let's talk about your post-op instructions. Everything I will go over is written down, and we will give you a walkout form before you go. So are you able to take ibuprofen?
Yep.
Okay, so as you are healthy otherwise, and the extraction is non-surgical, I don't think we will need to prescribe a pain medication for you. So ibuprofen is very helpful if taken every 4 to 6 hours. And I would advise you to take it on your way home with food before the local anesthetic started wear off. And that would be in about 90 minutes. So try to avoid food that's hot in temperature or hot in spice. And the best thing for now is something that's soft, so like ice cream, cottage cheese, or milkshake. And I will also avoid things that are difficult to chew, like raw salad, and use your discomfort as your guide. I will avoid chewing until the right side of your tongue is no longer numb, so you don't bite your tongue by accident. It's normal to have some surge of bleeding in the next hour or so. That's completely fine. If I were to I would give you extra gauze, and you fold it up, put it over your socket. then you bite down hard for 20 minutes. Do that for 3 cycles. And if the bleeding continues after 1 hour and you're worried, please call the emergency number. I will give you the emergency number and my contact information for you. And swelling is also very common. It usually develops 12 hours after the surgery, so like tonight or tomorrow morning, and it lasts for 2 to 3 days. And we will give you an ice pack that you can apply on your face for 20 minutes, just like the gauze, and then you take it off for 20 minutes so that your face, the skin of your face can go back to normal temperature. So I would advise you to do that for the next 24 hours. And as for brushing, you can brushing like normal, but try not to rub the surgical site because I don't want you to irritate the gum. And maybe when you're brushing, you can use the mirror, and so you can see what you're doing. Okay. Do you have any questions?
I don't think so. I think you covered everything.
Okay, cool. So we would like to see you in a week in our surgery to for a follow-up visit to make sure everything is healing fine. And I will give you the walkout form before as on your way to the front desk. And if there's anything that you're concerned, you can always call the emergency number on my personal contact number. And I will also call you tonight to make sure you're doing fine. Okay?
Thank you.
Walk out for it.
Okay, thank you.